This is Dr. Anderson with North Texas Plastic Surgery, and for this video, we're talking about facelift preparation. We might have to define what do we mean by facelift. There's a lot of overlapping terminology, and depending on what website you go to, you're gonna see a lot of different things. For the sake of this video, when I'm talking about facelift specifically, I'm talking about the tissues kind of from where your cheekbone is, down to your jawline, and then I always include neck in that as well. Now, like I said, you're gonna see all these other different words. We're gonna focus on that today, and I'm also going to talk about additional procedures that people often get with a facelift. So we'll wrap all that in and hopefully answer a lot of those questions as well. The most common complaint that I'm hearing from folks when they're coming to see me about facelift is they feel like the tissue behind the chin, so this area of the face, has kind of come down and forward. And then along with that, there's usually some amount of sagginess in the neck skin toward the center and sometimes down. Again, that's the most common thing I hear. So this area, I don't like this word because I think it has a bad connotation, but we call that a jowl. Jowl. So if you're kind of looking in the mirror and you're doing one of these and it's pulling on this and you're like, oh, that looks nice, it might be time to start having that facelift conversation. So as far as I am concerned, what we're going to be talking about is what's called a deep plane face and neck lift. What that means in the easiest of terms is I'm going layers beneath the skin to the tissue just above the muscles of the face, and I'm repositioning that in a higher, more lateral location to give the face a more youthful look. The reason I'm saying that very specifically is I think some of us in our heads have this view of a facelift from maybe like the 80s, where these ladies just look like their skin was pulled and tacked behind their ears. Back then, it was much more common to just pull on the skin layer itself, and that's what made things look so artificially tight and not particularly youthful. When we reposition the deep plane of the face, that lifts all that deeper tissue, so we're not really looking pulled, we're just looking like we have that more full, rounder face shape of youth as opposed to droopier, less taut face that happens, unfortunately, as we age, that we're all trying to fight. That defines a little bit more specifically what I'm talking about when I say facelift. Now let's kind of go over other things that are very common to have happen as well. As a plastic surgeon that does facial procedures, we tend to think in terms of thirds of the face. So we kind of have upper third, middle third, lower third. As far as the upper third's concerned, something that I'll frequently hear is, I feel like my eyebrow has drooped over time. So if we're wanting to reposition the eyebrow higher, that's called a brow lift. There's several iterations of that if that's one of your complaints, we'll talk a little bit more specifically at your consultation. What's more common when we're talking about facelift is the eyelids. So we have upper eyelids and lower eyelids. Upper eyelid surgery is called upper blepharoplasty. Lower eyelid surgery is called lower blepharoplasty. So very, very frequently, if we're having some sagging here, we're gonna have either skin excess or fat that's not in an ideal position around the eyes, and we'll talk about that as well during consultation. As we move down the face, the facelift itself is really going to take care of that middle third and that lower third, but another very common adjunct procedure that people will get is what's called a lip lift. So if we look closely at ourselves, if we have a picture of when we're 20 and a picture of when we're 50 or 60, there's a natural elongation of the upper lip. So the space between where the bottom of your nose is and then the more red or rosy color of your upper lip actually lengthens over time. And that is a very subtle thing, but it contributes to an aged appearance of the face. So frequently taking a few millimeters of skin and hiding that scar very beautifully in the natural shadow beneath the nose can help us achieve a globally more youthful look and be a little bit more discreet in what we're doing to accomplish that. And then, like I said, as we go down, the facelift and neck lift is going to take care of the lower face and the neck. A lot of people will tell me they feel like they have excess fat in the neck. And as far as I'm concerned, if we're talking about doing facelift neck lift, that's just part of what's going to be done in the procedure, where I don't almost ever, I can't really think of a time that I felt like we needed to do adjunct chin lipo or neck or submental lipo, however you want to refer to it, along with that, because I tailor that along with the neck lift portion of the facelift. All right, so if I'm saying those things and you think I'm describing you and you're like, all right, it's time to talk a little more seriously about this, the easiest thing for you to do is head on over to our website that we'll link below, and it's going to quickly guide you to how to give us information so that we can get you onto the lead team so they can start giving you more specifics about what to expect and how to have a consultation to come in and see me. So when you end up seeing me for consult, there's kind of several phases to that day for you. Initially, you'll come in and you'll speak with my nurse. What's kind of nice about that is it's a little bit less stressful, a little more relaxed setting, and you can go over all the things that you're seeing and just kind of flesh that out with her and start feeling more comfortable. She'll come chat with me. We'll go over your medical history, everything that we're expecting to talk about, and then I'll come in and chat with you and we'll go over that stuff in a little more fine detail, and I'll answer any other questions that you think of, and we'll come up with a really good specific surgical plan that's tailored to what you are seeing and what we can accomplish for you. I think one of the things that's important to talk about when we're discussing facelifting procedures is expectations. So if we're being honest with ourselves, facelift can usually kind of roll back the clock, hopefully about 10, maybe sometimes 15 years. And then I don't want to say unfortunate, but the realistic part of things is, what's unfortunate is gravity. Gravity still happens. So a facelift is not a procedure that lasts forever. Ideally, we'll get a really, really good 7 to 10 years out of it. And a lot of folks after that amount of time, their face still probably looks better than when we started. But they're like, I don't want to go through that process again. So maybe I'll do a little Botox or I'll do a little filler, just like a little maintenance stuff, rather than trying to think about second surgeries. Okay, so we've had our consult. We've decided it's the right thing to do to proceed with surgery. So prior to surgery, you'll come in again and have a pre-op visit. So part of this is that we're doing an absolutely elective procedure that you want to have to, feel better, look better. So if we're doing elective surgery, we are going to ensure going into it that we are being absolutely as safe as possible so that we can decrease the likelihood that you have a bad outcome or a problem after surgery. So the vast majority of people that come in for facelift are going to need to see their primary care doctor to have what's called medical clearance. So they do physical exam, there's labs, usually an EKG, every once in a blue moon a chest x-ray, to make sure that all those normal things are in fact normal, so that, again, we can get through surgery without problems. I and my anesthesia team personally review every single chart to make sure that nothing's slipping through the cracks and we're not missing anything to, again, ensure your safety. Let's assume that we are medically optimized, ready to go. There's then a medication regimen that we'll discuss that is a combination of different pain pills that work on different pain receptors so that we're minimizing pain after surgery. Now, to be totally honest, people don't complain about too much pain after facelift surgery. That's something I see much more frequently in like a tummy tuck patient. So if you've had tummy tuck in the past, C-section, other surgery, a lot of times the recovery from this tends to be more comfortable from a pain perspective. In addition, I like to mention that I prefer to do this procedure under a general anesthetic. For me personally, that makes surgery safer for you because I can manipulate my tissue planes and move things around in a way that's just much more comfortable and allows me to do surgery a little bit more expediently so that we can optimize the amount of time that we're actually under anesthesia. Now, this always makes people nervous, and that is totally appropriate, but I always tell folks the silly joke that anesthesiologists make: is it's technically safer to undergo anesthesia and have your procedure than it is to drive to the place itself. So again, I don't take that lightly, but it's overwhelmingly safe to do surgery that way. Let's go into some of the practical considerations leading up to and after surgery. So as far as time off goes, I will, a little bit tongue-in-cheek, tell people that this is more of a social recovery. As we talked about, the pain's not really too bad for the vast majority of folks, but your face is swollen, you're bruised, you have visible sutures. So a lot of people don't want to like go to their weekly card game or run to the grocery store looking like that. So usually by 2 weeks, you're feeling like the bruising's gone, all your stitches are out, you're still swollen, but a lot of it's gone down. And honestly, when we're a little bit swollen, our faces look full and young, so it's kind of nice. But by 3 weeks, it's really safe to think like if I have like just something I need to go to, maybe not, you know, an Oscar party, but like your normal events, probably 3 weeks is pretty safe for that. I tell folks, especially if we're doing eye surgery along with the face, we really need to give 3 months to see what I would call a final result, because it just takes time for that swelling to go down and things to reposition and settle out where they're going to be. As far as setting up your house, not too much that we really need to do there. I do prefer for the first couple weeks that you sleep elevated. So that is really honestly as simple as having a couple of pillows behind your back. Some people have a recliner in their house and they just feel like a little more comfortable in there. They think like if I get in bed, even if I have pillows, I'm gonna move around and end up in a not ideal position. But like I said, just back elevated is usually sufficient. As far as garmenting goes, I do have you wear some compression and what I call a lovely face bra to keep things minimally swollen as much as possible and in place. And that's going to be at minimum 3 weeks, pretty much around the clock. So again, that's kind of that 3-week time period that I was alluding to. The post-op care specifically for you is not terribly hard, but we do have a couple extra visits to the office with this because of the sutures. So with facelift, there's always some external sutures that you're going to come into the office and those are going to be removed. So the first time that that's going to happen is at a week after surgery, give or take 7 days. Sometimes it's on day 6, sometimes it's on day 8. That's okay. And then about 5 days after that, sometimes 2 weeks. So about day 7 and then about day 12 to 14 is we have 2 things of suture removal. So a couple extra office visits for this one. And that also helps making sure that everything's healing beautifully and just the way we want it to. So let's be honest and not gloss over stuff. Let's talk about some complications that can happen. Fortunately for facelift, complication profile is honestly quite rare, and it tends to be things that don't at all affect long-term outcomes. So the most common thing that I have seen is one little stitch somewhere will pop through and we'll get a tiny little gap in the skin. That, because the blood supply to the face is more robust than just about anywhere on the body, your body's sending all these nutrients and those heal so fast and almost always become imperceptible. A little bit more long-term, couple to a few weeks out, what I have seen, and it's still infrequent but does happen, is some of the stitches that are underneath the skin, instead of your body deciding it's going to break them down like it normally does, it pushes them out to the surface and those can pop through in places. A lot of times what will happen there is you'll get a little red spot that's really focused and it'll come to a whitehead almost like a pimple. And a lot of times once that pimple pops, whatever remnant is left of that suture comes through and it just heals up totally fine. If we're being stressed and we just feel like oh my God, I have to do something, we'll put a little antibiotic ointment on there just to kind of spur it along a little bit. Another thing that I'll see that isn't necessarily a complication but can stress people out is if I've made an incision under the chin to help me do all my work in the neck, a couple of those stitches when you lift up will leave like a little line. That totally fades and goes away in time. But I've had people like 6 weeks after surgery, they come in and they're being really nice and sweet, but they're like, what's going on here? Like, it's gonna be okay. It's just the stitches. Once your body breaks that down, it all flattens out and smooths out. So there are a couple less common complications, but certainly things that can happen. Some of them that we deal with on a very quick basis. Some of them, unfortunately, we just have to let time pass and they tend to resolve on their own. So something that can happen is if we've done the incision that goes all the way up along the hairline, where the skin comes up here, if we feel like that skin isn't healing perfectly, if it's turning a little bit purple instead of being like our natural pinkish hue or tan hue or brown hue or whatever, we may start some gel or some cream that increases our blood supply to that area. Because what that's saying is it's not getting enough blood flow to heal as easy. If that looks like it's progressing, and this is something I haven't personally had to do, but I'm ready to pull the trigger if it's ever needed. If that's getting more and more purple, we may have to consider doing what's called hyperbaric oxygen therapy. And that, the vast majority of times, will get that to resolve on its own. Now, if it doesn't, what will happen is we'll just have a little bit of widened scar there. Again, I haven't actually had this issue, but I'm going to talk about it. We'll revise that a couple months down the road once things have softened, and it'll just fade into your scar and it'll be like nothing ever happened. The other, I think this is a more surgeon feared complication than actually patient feared complication, but it's worth mentioning, is when you're manipulating facial tissues, there are nerves that go to the muscles of the face that help us move our face, talk, communicate, smile, frown, do all of those things. We like for them to be totally normal, just like I'm talking to you here and I have a normal face. Sometimes after surgery, because of either the way the tissue's manipulated or the numbing fluid that I inject to help me with my tissue planes, those nerves can go to sleep. For the vast majority of people, that will resolve overnight, but you can wake up and if you smile, you maybe have a little bit of lip that goes down on one side. Most of the time that's numbing. Sometimes that's more long-term. If that's the case, the absolute vast majority of people, we're talking well over 90%, the body will iron that out and fix it within 3 to 6 months after surgery. The chance of, and I'm going to be, knock on wood, very fortunate, I haven't had this issue yet. It's possible, but I haven't, but I'm humble, so it can happen. The chance of having a long-term nerve issue after this surgery, based on the most recent literature that I've read, is actually less than 1%. So I always harp on it because we don't want that to happen, and we're going to talk about it at your consultation, but the likelihood of that is actually quite low. And this has been Dr. Anderson with North Texas Plastic Surgery. If you liked this content, please like, comment, subscribe below, and check across all social platforms. We're posting it there too.